Hi, this is Dr. William Rollow. I'm the president of the Maryland Society of Integrative Medicine. And I'm just recording this to give you a heads up that we have our November webinar coming up in a short time. It'll be on November 11th, the usual time, 7 p.m. That's a Tuesday, running until 8:30. This month's webinar, I think, is going to be fantastic, actually. The broader topic is inflammation and the genetics and epigenetics that affect it. So in the broader context, we often in integrative practice see patients that have a fair amount of inflammation, some form of chronic illness that's manifesting in fatigue or pain or joint achiness or brain symptoms, that kind of thing. Many manifestations of that. Although we do a lot of the typical things that we do in integrative medicine, there's a subset of those patients who tend to have persistence and have difficulties resolving it. And we always think that there probably is some genetic predisposition to that among those individuals, but we often don't really have a very good way to actually be specific about that. So in the webinar that will be happening in November, we'll be talking with a clinician and an incredibly bright, well-researched student of the literature of inflammation and genetics. A practitioner, actually a dentist, named Dr. Harold Landis, who's based in Silver Spring, Maryland, but works as part of the Nutrigenomics Research Institute with Bob Miller up in Pennsylvania. And I've been participating in the activities of that organization for more than a half dozen years. They're very, very science-based and excellent. And what Dr. Landis will talk about in general is how a genetic analysis can enable us to identify things, typically supplements, sometimes other substances, that can be helpful in patients who are otherwise not really able to be very well helped because their genetics get in the way of resolution of their inflammatory illness. But alongside of that, Dr. Landis is going to do a special dive into a subject that is now out there in the news a lot, actually, which is autism and the relationship between autism and acetaminophen or Tylenol use. As I think everybody knows, this is extremely controversial at this point. Dr. Landis has used his expertise in this whole area as a way of taking a look at the literature and talking some about that. So it'll be inflammation, epigenetics, nutrigenomic analysis, acetaminophen, Tylenol, all wrapped into one. I think it's going to be fascinating, and I really encourage you to take a look at it. It'll be, again, Tuesday, November the 11th, 7 p.m. If you're not a MSIM member, go to our website, msim-info.org. Sign up. It's only $50 for access to all the prior webinar recordings and the upcoming ones, including the November one. And I think you'll find it well worth your investment. Take care, everybody.